welcome on back. Good morning, how are you this morning?
I'm fine, how are you?
I'm fine. My name's Stacy. I'm gonna get you ready this morning. Do you still have periods? And
Yes.
okay, I need you to get me a urine sample because they will not do your surgery unless we have that on the chart. Okay, it's right there. With the urine sample, you also do have to put a sticker on it with the time, the initials of the person that took it, and also the date. And that has to be go to lab. All right, thank you. All right, you can come on over here and have a seat. Just ask you a couple quick questions. Birth date's 5/1/1967.
Yes.
Any allergies to food or medication?
No.
Okay. Gown. Everything has to come off, including your jewelry. Gown will open in the back. Pair of slippers there for you. We do have this bag to put all your stuff in. We just recently got lockers, so I will lock all your stuff up and bring the key back over here for you to have at the bedside.
Okay.
You're having a right shoulder scope with Dr. Moeller today?
That's right.
Correct? Okay. I'm going to go, first of all, I'm going to go ahead and get your blood pressure. Did they have you take any of your medications if you're on any this morning?
No, I'm not on any.
Okay, that's fine. So nothing to eat or drink since midnight?
Right.
Okay. How's your vomiting post-procedure that you've ever noticed before, that you get sick with anesthesia or anything like
I've
that?
never had surgery before.
Okay. Anybody in your family have problems with anesthesia that you know of?
No.
Okay. Perfect. I need 6. Okay, I'm going to take a look at your shoulder here just to make sure everything's okay. We want to make sure there's no cuts or bruises or anything like that. Looks good. I'll tell you a little bit, when you come back, you'll probably have a dressing that has like a tegaderm over it at the site where he went in and looked at everything. Probably a bandage on there, and Dr. Moeller will let you know if he wants you to take it off in a couple days or he wants to leave it on until you get post-operatively to see him. You might come back with a sling. It just depends on what he wants. So we'll go over all of that once you're back here. Once you're done with your procedure, you've been in the recovery room for about 45 minutes to an hour, you'll come back here with me. You definitely have to drink something before I let you go home. And then also we offer crackers or something light. We don't want you to eat a full course meal or anything like that. We can get you something for pain. We'll check and make sure your fingers blanch well, make sure circulation's going good. Dr. Moeller might want you just to do some few exercises, so he'll tell us what he wants you to do. So we'll go over all that, and you'll have a printout too. This kind of gives you, an understanding of what you're going to have afterwards. So,
Okay.
All right. Leave your wedding ring on.
I'd like to, please.
Okay. We're going to put a piece of tape on that. Also, since you are having surgery on the right shoulder, we're going to start your IV on the left side. We like to go to the opposite extremity. So let me take a look here and see what you've got. You've got a nice vein there. Okay. Now, have you ever had an IV before?
Yes.
Okay. So you know it stings just a tad bit. Sorry. All right. Since you are having a general anesthetic, we like to put a number 20 IV in. And that's just because if you would have any problems, that gives us nice access to giving you fluids and stuff like that. The anesthesiologist also has requested that we put a little bit bigger needle size in there, so it might sting just a tad bit. All right, since I've got you ready to go, is there any questions that I haven't answered that you'd like to know?
No.
Okay. Dr. Moeller usually likes to see you 7 to 10 days post-operatively. And he'll discuss physical therapy with you at that time if that's needed. Also, he'll let you know what to expect on the road, how many, you're going to be off work for a few weeks. You're not going to be able to do any heavy lifting. He's going to say, okay, I want you to do these exercises to keep that mobility up and everything like that. So,
How long will it take before I start feeling better?
For the first 24 hours, you're going to be kind of groggy and stuff like that. Anesthetic kind of does that to you. Then as the days go on, you're going to be taking some pain medication, so no driving, no operating any heavy machinery or anything like that. You might be dizzy and drowsy from that pain medication. It's probably going to be a good 3 to 4 days before you start feeling back to normal. So, and then whatever he says, each surgery is a little bit different, so whatever he wants you to do, you can kind of gear it from there. Okay.
Thank you, Stacy. Come in.
I'm Peggy, I'm from surgery, I'm going to be with you before, during, and after your procedure, and I just came in to say hi and to ask you a few questions and go over a couple things. I need you to tell me your name,
Tammy Martin,
and what's your birthday, Tammy?
5167.
And what are you allergic to?
Nothing.
All righty, and what are we doing today?
I'm having a right shoulder scope.
Which shoulder?
My right one.
Okay, that's the correct one. Okay. Did Dr. Moeller mark it?
I think so.
Okay, yep, he did. All righty. And I'm just checking your pulse.
Can I have just a sip of water?
No, I'm sorry. They would skin us alive, the anesthesiologist and the surgeon. We'd be in big trouble. I need you to just wiggle your fingers, and they feel normal. Any numbness or tingling?
No.
Okay, all righty. And you said no allergies, correct?
Right.
Okay. And IV's on that side. That's good because we're operating on this arm, so IV needs to be on that. Everything is taped. When is the last time you had something to eat or drink?
10 o'clock last night.
Sorry to remind you of that. And you told me no allergies, correct?
Correct.
Okay. Anything removable, contacts, hearing aids, dentures, jewelry, piercings, underwear?
I still have my contacts in.
Okay, we'll have to take those out. Does your husband have a case, or do you have a case here?
Yes, I do.
Okay, we'll get that and get the contacts out.
It's in my purse. My husband has it out in the waiting area.
Okay, I'll run out and get it from him. When we're done here, we'll get your contacts out. Anything else removable?
No.
Jewelry, piercings, underwear, naked is, oh, okay,
Mhm.
all
No, I'm
righty.
naked.
Okay. Any metal in your body anywhere? Like screws, plates, any previous surgeries?
No.
Okay. Any health problems, diabetes, hypertension, strokes,
No.
problems with anesthesia? Okay, well, no, since it's your first surgery. Now, do you have any questions for me?
Not yet.
Okay. Anesthesia, somebody from anesthesia will be around to talk with you. They might slip you a little something through your IV before we go back. After Dr. Muller's, when we get the room all ready, Dr. Muller's ready, we'll take you back. We'll help you get off this bed onto the OR table. We'll all be in there with you. We'll lay you down. Anesthesiologist will be talking with you. Next thing you know, we'll have you just breathe some oxygen through a mask. The next thing you know, you're going to be asleep. The next thing you know, we're going to be telling you to wake up and it'll be all done.
Will you be there when I wake up?
Yes, I will.
Will Stacy?
So you'll see her after you see me, okay? You're stuck with me for a little while in
Okay.
recovery, and then you'll be with Stacy after that, and you'll be with Stacy probably an hour and a half or so. You'll be with me probably an hour or so.
Okay.
And I've got plenty of pain medicine, and we'll get you as comfortable as we safely can. And I'll be asking you to wiggle your fingers and that kind of thing every so often. But, and then you'll get to see your husband when you get back to the same day area.
Okay.
Now, I'm trying to think, was there anything else or anything I can do for you? Are you warm enough?
I'm warm. I'm just so thirsty.
I know.